Well, I guess everybody's ready. I want to thank you guys for joining us for our first Stay Well, Stay Connected Facebook Live discussion. I'm Russ Parr from the Russ Parr Morning Show on Radio 1. And our guest today is Dr. Eric Griggs. He's the Assistant Vice President of the Department of Community Medicine, Access Health, Louisiana. How you doing, sir?
I'm good, sir. How are you?
I'm just fine. We're talking about a subject that I have just worked so diligently to get information out to every community, especially my community. But with fall here, health experts are predicting a problem with COVID and the flu. Some people are calling it a twindemic. Would that be accurate? Should that be of a concern of ours?
Yeah, it's what's interesting. A twindemic, at the very least, would be what I would call it. The flu season hit early and hit hard in the southern hemisphere of the world. As we found out in Australia, we had an epidemic of RSV, or respiratory syncytial virus, in our kids that has already started. We know that the number of flu shots is down from what it's been over the last few years. And we also we predicted that there would be more variants coming. So it looks like it's going to be quite an active winter season when it comes to respiratory viruses.
One of my biggest concerns is in a couple of weeks, we're going to be celebrating Thanksgiving. Lots of turkey, which means lots of family. I've got people coming in from out of town. I remember in the beginning of the pandemic, it was advised to not even have Thanksgiving with family. Obviously, that's changed. Should we have the same precautions as we did back then?
So I will say, I've been around since the very beginning of this. With the 100 Black men, we were working to get the message out, and I've been at the forefront in the fight with you, trying to get people to get vaccinated, protect themselves. Was vilified because a lot of people didn't want to change their habits, and that was one of the concerns that we had, is that when we're able to get somewhat of a handle on COVID, people would be fatigued, and some of the restriction would be relaxed, and that's what we have now. So Thanksgiving is going to happen. Big Mama and everybody are going to be at the house, and you name it, we're going to be fighting over turkeys. The problem is we need to do what we can to protect ourselves, and all of the precautions, everything that we've been saying for the last 3, 4, 5 years. I mean, the last 3, 4, 5 years, in the sense that we've been telling people, if you don't feel well, stay away from the family gatherings. And then we've been telling everybody to get a flu shot. We've been telling everyone to get COVID vaccinated. We've been telling everybody to do it in a well ventilated areas, and do as much as you can inside and outside to be cautious. All of that is the same.
And I think one of the other things, Dr. Griggs, people try to shame you for wearing a mask. And I don't know if you've heard that, but I'm on an airplane. I'm probably, maybe me and 4 other people are wearing a mask, and I can hear them talking about me. And it's like, especially when I fly to Texas and some of the deeper red states, I hate to make it a political thing, but perhaps it is, because a lot of these states just weren't stepping up as far as protecting their citizens, as far as I'm concerned. But I still wear a mask in a large group of people. I'm shooting a movie right now. We're outside. I'm not wearing a mask, but we're getting ready to come inside. I'll probably be the only one with a mask, but I can't ask other people to wear a mask. Have you been finding?
Go
ahead. I'm sorry.
Yeah, you hit it right on the head. We moved into a stage of personal accountability to the point that really some people I don't know if they ever really wanted that to begin with. Wearing a mask is one of the most responsible things you can do, particularly if you do not feel well. I think as we've gone over the evolution of the pandemic with COVID, we started using the misnomer, a term called, it's a milder form. It's not, it's a milder form. The disease, the symptoms of the disease are milder for those that are vaccinated. This is still COVID-19. We still have 400 people a day dying from this disease in the United States. That's not normal. In no state is that a normal state. So we have COVID out there. We have the flu out there. We have respiratory syncytial virus. You have strep throat. You have a number of the run-of-the-mill cold viruses out there. It just makes sense that you want to protect yourself as much as possible. And even though you feel alone, I want you to understand that you're wearing your mask. I'll have mine on, and you're not alone in the fight.
Yeah, I shun those folks that want to like look at me like I'm a leper or something, but that's ridiculous. One thing that I have noticed is that we have a lot of folks, especially in the African American community, they have a distrust for doctors, medicine, the system, um,
Yeah,
and
no shade. I saw your eyes with that. No shade. Not me personally. I don't take it personal.
but it's just like it's like man, I don't believe in that. I don't put that stuff in my body and so on and so forth. It has been proven that the vaccine is effective and safe.
It has been proven time and time again that the vaccine is effective and safe at keeping you from being hospitalized and or dying. We know that these vaccines work. The distrust has been there for hundreds and hundreds of years, and rightfully so, because there's been mis and disinformation and conversations that haven't been had about what's happened in the past. Now we're past that point when it comes to vaccines. We know that they absolutely work. We know that these boosters that they work in, as technology evolves, we'll get better and better at it. And that's what the studies are showing, and that's what we're seeing in numbers, in the numbers now.
And that was interesting because I just read something the other day where they're saying that the new Omicron booster is far more effective than they ever thought it would be. Why is it that they find out this stuff later as opposed to, when they put it out? Because that's where the distrust comes in. They're going like, well, does it really work? And now they're saying, well, it works better than we thought. So that makes, the average Joe going like, well, wait a minute. Why didn't you say that in the very beginning? Why is that the case?
Well, it's the thing, it's called science, and science is called an art, and that's how we can predict what we think might happen. I mean, it's like if you watch football, you can predict who you think might happen, but you don't know until you really play the game. The historical data that accumulates over time is the data that tells the truth, that tells the story. This vaccine, this new vaccine, it's a bivalent vaccine. Bivalent meaning two. It has two of the old strain of the, I will say, old version of the vaccine, plus the new vaccine to cover the new variants that have come out. So it's working together to stimulate the immune system to protect us from being really, really sick or dying. If anyone's ever had the flu, I'll put it this way, and I've been saying this for a while, I don't know anyone that's had the flu that has been hospitalized. I know the numbers are up now for hospitalizations for the flu, higher than in the last decade. But if you've ever had the flu, you never want it again. It's the closest thing that you feel like as a healthy individual to dying. Well, that feeling up until the point you're hospitalized is a mild form of COVID-19. It's a mild form. Every year prior to COVID, 50 to 60,000 people die per year annually of the flu alone. With COVID, that number is 10 times. We've lost 1 million over the last 2 to 3 years. These are not anything to play around with, nothing to discuss lightly or to be jovial about. This is something that we need to do to protect ourselves and use these things called NPIs. What is an NPI? You probably heard people talk about it. It's non-pharmacological interventions. It's those things, the motherwit things that my grandmother talked about. Common sense, washing your hands. If somebody's sick, stay away from them. If you're sick, stay home. If you're sick and you have to go out, wear a mask. If you can work from home, the day and age now is you can work from home to protect those around you and to save your own life.
The biggest fear that I have, because I've had every booster shot. The last time I got my booster and my flu shot at the very same time. And I got to tell you, I didn't even get a sore arm. I mean, it's gotten to the point. I mean, I remember I got the first COVID shot and my arm was sore as heck. Yeah, you don't even get that anymore. So, I mean, they've definitely improved the vaccination. What I'm finding interesting is that people don't realize it's scary. It is scary to get both at the very same time. We touched on the twindemic, but you can get the flu and COVID at the same time. Is that accurate or am I wrong?
Absolutely accurate. And I've been saying this every year for the last 3 years. There is no law of man nor science that said you're restricted to only one virus. As a matter of fact, being infected, viruses and bacteria are opportunistic, right? It's like if they can distract you from fighting one way, another one will try to jump on your back. So it's possible, believe it or not, it's possible to get the flu, RSV, and COVID at the same time.
Oh,
if you can only imagine.
That's a storm. That is a storm. All right. So, these updated vaccines are available now. I called my local drugstore and they got me right in. And you made a point that there are a lot of people are not getting the shot. And that disturbs me. So I do spend my time on the radio at least once or twice a week to encourage people to do this, if not for yourself. I have a 93-year-old father. So I don't want him to have to even though he's protected with vaccinations, I still act like, okay, we're not vaccinated. It's about protecting others and not about just yourself. But with the updated vaccines, they're available everywhere right now, right?
They are available everywhere. Call your local pharmacist. That's a great resource. Talk to your healthcare provider. You can go online and find out about updated vaccines or boosters near me. And there's locators. It's available. It's almost ubiquitous. You can find them if you need them and you want them. They're not hard to find.
I'm so honored to be associated with Stay Well and Stay Connected because this information is so vital. And for you to take the time to share your knowledge, I think it's very important. HBCUs, we're on those campuses. It's homecoming season. I know Howard just had theirs. My son's a graduate of Howard, and in the yard. I'm not sure if you're familiar with the yard at Howard University. There were literally 3,000 packed kids.
Wow.
What made me feel good was half of them had masks on. Half. That's pretty darn good. You would like to have all of them, but half of them had their mask on. So that tells me the information is getting out there, which is kind of important. I know Staywell is doing an HBCU campus tour. I know in Alabama State University, November 12th, 12 noon to 3. Alcorn State University, I believe it's going to be November 19th, 12 noon to 3. Jackson, Mississippi, SWAG championship game, December 3rd, 12 noon to 3 p.m. The Celebration Bowl in Atlanta, December 17th, 10 a.m. to 1 p.m. It's important that we all just stay informed and try to inform everybody else. Also, there's a website everybody can go to. That's www.staywellevent.org. That's very, very important. Is there anything that I missed, Dr. Griggs, that you need to tell us about right now? Because I don't want to leave one stone unturned.
No, I just want to reinforce everything. I want to thank you for everything you're doing, joining us out here in this fight, trying to protect as many people as possible. And just like we said, once we play the game, the numbers will tell the tale. We just have to stay to it. We're winning. It just doesn't feel like it. We just have to encourage people to protect. It's not just a matter of protecting yourself, it's protecting your family. Get your vaccines and wear your mask and understand that you're not alone.
Absolutely. Dr. Eric Griggs, thank you so much, sir. If we change the minds of at least 5 people, we've done our job. Because this is, it's absolutely a win. I'm hoping a lot more than that, but this is a start. And I'm looking forward to doing more and hopefully you're still stay connected with what we're doing. I know we're doing that at Radio 1. It's very important that we get this information out to protect our communities. And thank you so much, sir. And I really appreciate the time. It's an honor to meet you, sir.
Thank you. Honor for me as well.
All right. Take care now.